Good morning. Today is Saturday. Let me check the sound system first. If you just give me a little time. Okay, sound check, sound check. Sound check, sound check. Okay, everything is working fine. Okay, this is a brand new year. We had a request how to start the yoga practices, primarily the asanas, pranayama, and meditation. We talked about last two sessions how to start a asana practice and how to start a pranayama practice. Today our discussion and the practice will be how to start a meditation practice, and I will demonstrate all the meditation practices, and I'd like you to practice with me and follow with me. Meditation is the seventh limb of yoga practice. Out of the 8 limbs, first one is a yama, social restraint. Second one is a niyama, personal restraint. Asana, third, external and internal alignment. Fourth is a pranayama, voluntary regulated breathing. Fifth one is your pratyahara. Pratya means reject, ahara means input. Input is through 5 senses, controlling your 5 senses. Sixth one is a dharan, is a focus. Seventh one is the meditation, the dhyan. Eighth one is samadhi, is the union of body, mind and spirit. We prepare our body and breath for a meditation practice. You just don't sit down, close your eyes, follow your breath and say that is meditation. First, you have to prepare your body in a relaxation response and a asana which we call sthiram sukham asana. Sthiram means stillness, sukham means happiness, asana is a pose. Sit down in a pose where you will be still, will be happy. In that profound relaxation response, you develop an activation of parasympathetic tone and your breathing becomes completely effortless. You have an exhalation longer than inhalation, and the breath is a connector between your body and mind. As I always say metaphorically, if you're flying a kite, the roller in your hand is the body, the kite is the mind, and the thread connecting the roller and the kite is a thread which is your breath. Breath is both conscious and subconscious. Conscious breath, I can breathe. This is the function of your conscious, of your brain cortex. I'm sleeping, I'm breathing. Unconscious breath, which is a function of my brain stem. So breath is also connected between your conscious and subconscious mind. When the body and breath is prepared, you enter into a meditation. Meditation we call is a medication. If yoga therapy is a pill, asana is a pill, pranayama is the active ingredient, meditation is the mechanism of action. We call meditation as a medication, and the difference between the two words is T and a C. Meditation has a T, medication has a C. T stands for your transformation and C stands for your choice. You have a choice. choice of taking pills or choice of taking a daily yoga practice. It is a medication because if you look at the root word of the meditation, medere, Latin medere means the health. Medicus, Latin medicus means a physician. So it's all connected to your health and healing. In a meditative state, what happens that our mind has a thought process. It generates a thought process. It generates thousands and thousands of thought processes. Most of the thought process are in the past and in the future. We have very little thought in the present, and all the thought in the present also have repeat thoughts. I have to come, I have to talk to you, I have to present it. It all keeps on coming to me. Meditation enters the in-between the thought process, called a gap. It starts increasing the gap, so the repeat thought process slowly and slowly goes away, and you end up with the real thought process. Meditation is not a thoughtless. Meditation is quieting down your, what you call a monkey mind. Chitta vritti nirodha. Chitta is a mind, vritti is a chattering, nirodha is a control. Controlling the chattering of your mind. Metaphorically, our mind was like a fall, maybe a Niagara Fall. In meditation, first it becomes a river. Slowly it becomes like a pond. Finally, there is no ripple. When you can see the water all the way down, mind quiets down. So what are the meditative practices? Mind, according to yoga, is a content of your five senses. Our five senses are: I hear, I see, I smell, taste, and touch. All the contents, when it's put in a container, that is our mind. When that content is processed, it becomes our intellect, called buddhi. When buddhi becomes more processed, it is called your wisdom, Anandamaya Kosha. So the practices for meditation first is a very quick, able to control your five senses. And I will show it to you how to do it. Second, we call a focused meditation, or we call a visual imagery. You can close your eyes, use a hand mudra. As you know, hand connects your body and mind. This is called a dhyana mudra or jnana mudra. And then you focus. You can always put a visual imagery, like you can focus like you are sitting in a beach in front of a ocean, or in front of a mountain, or focusing on a flame of a candle. The best focus meditation is called breath-centered meditation. Our breath will guide us to a meditative practice. Pranayama, also a meditation, because pranayama prepares us for meditation, and we have an alternate nostril breathing, Anulom Vilom Pranayama. We do an alternate nostril breathing without closing our nostril. That is called meditative alternate nostril breathing. Focus is also a mantra. Mantra is a chanting. Mantra is a vibration. Our brain has a vibration, our mind has a vibration, our body has a vibration. When you create the vibration, two vibration cancels each other, is called a harmonic resonance. The chanting sound, yoga gave it to us, is a Om. Om has almost the same frequency as the frequency of our brain and the body. A pranayama called Pranubhav Pranayama, which practices the three component of Om, A, U, Ma, with hand mudras, Chin Mudra, Chinmay Mudra and Adhi Mudra. That is your chanting meditation. Meditation is also a moving meditation. When you're walking, pay attention, quiet down your mind. When you do Kadi Chakra Asana, like a west rotation, you stand, you put your hand, you breathe out first, you breathe in, then breathe out. Slowly move your hand all the way to the back with your eyes closed, breathing out. And in the same breathing, you can bring your hand here and close your eyes and breathe. It is very important for people with kapha, because the kapha in a grounding pose in the meditation, they loses all of their attention. Vata people needs to be grounded for a meditation practice. Moving meditation. Mindfulness meditation. Always pay attention what you are doing. I'm talking to you. This is my meditation. I'm reading a newspaper. That is my meditation. I'm cooking. I'm in meditation. Closing your eyes, scanning your body. Whole body scanning is a meditation. You scan from your toes all the way up to the head. You can scan your body with a relaxation meditation. Relaxation meditation is called instant relaxation technique, quick relaxation technique, deep relaxation technique. Time permit, we'll show it to you. Then you have a loving kindness meditation. Playing with your grandchildren is a meditative practice because it activates your parasympathetic tone. I have a cardiologist friend who is very much in this contemplative practice, and he always tells me that when he's playing with his grandchildren, his health tracker shows that he has a parasympathetic activation. Spiritual meditation, any spiritual practice, contemplative practice, going to the church, for the Jewish Kabbalah practice, for the Hindus going to a temple, doing a puja is a meditative practice. In Islam, namaz, roza, hajj, zakat, you name all the Islamic practice and meditative practice. In a namaz, the body postures you do all the yogic practice, all the yoga asanas. Finally, most therapeutic meditation is called a chakra awakening meditation. We have 7 chakras. Each chakra is assigned to an organ system like circulatory system, your cardiovascular system, musculoskeletal system. I will end with the chakra awakening meditation with the vibrations of chanting for each chakra. What are the chakras? And we'll go over with it during our chakra awakening meditation. Let's go ahead and start the practice. So you can practice sitting in a chair, and maybe I will go to the mat, and I'll sit down in the mat doing my practice, and you can all join me. You could all join me to the practices. Very simple practices we'll do. So you will be all able to do it. As I said, a grounding pose You need a grounding pose, and grounding pose is very important for people of Vata. Vata kind of people needs a grounding pose. Give come a little front so you will see me more better. The first meditative practice, very quick meditative practice, is controlling your 5 senses. Now, all of you know that our most powerful of senses is our vision, because eye is the direct extension of your brain. Eye is supplied by almost 4 or 5 cranial nerves. The main nerve from the retina, optic nerve, goes directly into the brain. Closing your eyes is a meditative practice. Keeping your spine straight and able to sit down in a chair or in a ground in a sthiram sukham asana. Stillness, happiness in an asana is a meditative practice. Now let's see how we control our 5 senses. You touch your index finger and thumb. This is your Dhanu Mudra or Ganu Mudra. Put it just gently over your knees and close your eyes. Visualize 5 objects around you. I'm in my yoga room, I'm in my office room, I'm in my computer room. I'm visualizing 5 objects. Closing your eyes with the visual imagery, you touch 4 of these objects. Pick up 3 of these objects and try to smell those 3 objects. Pick up 2 objects out of 5 and try to listen to the sound of those 2 objects. Finally, pick up 1 object. Try to get a taste of this object. When you do this practice silently, you will totally enter into meditation. I'm talking because I'm guiding you. Here, what you have done started with the 5 objects with the 5 vision. 4 objects with the touch, 3 objects with the smell, 2 objects with the hearing, 1 object with the taste. Following that, you do pumming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, and if you're wearing glasses, Remove your glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand. It relaxes your ciliary muscles. Ciliary muscle tightens up your lens. By relaxing, the lens gets more convex. You may not read as reading glasses. Most of the yogis don't wear glasses, including me. Slowly take your hand, massage your forehead. Massage your eyes, massage your face. All the muscles of this area are attached to your skin. When the muscles are relaxed, those frowning goes away. All the lines you used to see before from the contraction of the muscle goes away. Looks like you are glowing. Looks like you have a young, rejuvenated look. Take your hand behind, massage your earlobe, massage behind the ear, in front of the ear. You can even put your finger inside the external auditory canal. There's a branch of the vagus nerve called auricular branch of the vagus nerve. Vagus nerve is the activator of your parasympathetic tone. Vagus nerve is a mediator of your meditative practice. Take your hand, massage in the both sides of the neck. These are called carotid sinuses. Carotid sinuses quiets down your cardiovascular system, your nervous system, and it is connected to your vagal nerve parasympathetic activation. Take your hand, massage just below the tubercle, the insertion of the sternomastoid muscle and the trapezius muscle. Both are supplied by cranial nerve. You quiet down your cranial nerves. Wonderful short meditative practice. Focus meditation. As I said, you can close your eyes, have your hand mudra, and focus. Focus in an ocean. You are sitting in the beaches. Put your focus the tip of your mountain. Put your focus on flame of a candle. When you keep focusing and slowly you get completely defocused. When you completely defocus, this is the sixth limb called dharan, and from defocus state you enters into the seventh limb, which is the dhyan, which is meditation. One of the best focus is also breath-centered meditation. You can practice with me if you want to, or you can listen to me and you can practice a little later. Always breathe through your nostril. Do not breathe through your mouth. God gave us the mouth to eat and to talk. Lung is like a balloon. It has 6 liter capacity and we only need 1.5 liter to keep the lungs open. There were 4.5 liters gas that can be exchanged. In a normal breathing, we only breathe 0.5 liter, 500 cc, which is the tidal volume. So in a breath-centered meditation, you breathe out first. Visualize your breath. Visualize your breath coming in through your nostril. Nose filters all the air coming from outside. Nose is also your personal air conditioner. If outside air is warm, it will cool it down. If outside air is cool, it will warm it up. Air goes at the side of the nostril called a channel called the turbinates. When it goes over the turbinates, it creates a vortex. The vortex goes over the mucous membrane of the sinuses and it secretes a substance called nitric oxide. Nitric oxide is the most powerful vasodilator. It opens up a blood vessel and it is an activator of your parasympathetic tone. There are other substances which activates parasympathetic tone, like your cyclic GMP, your acetylcholine. Nitric oxide is also supports our endothelial health. Endothelium is the inner lining of your blood vessels. Especially we talk about endothelial health of the coronary arteries, the blood vessels going to the heart. They're a little different. Endothelial health is our health. Visualize the air coming behind your throat. Coming down from the upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. Hold your breath for a while, called a cable kumbhak. Then visualize your breath coming out. Lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through the nostril, and the air is coming out as an exhalation through your nostril. Now visualize that your breath from outside is picking up a subtle energy called prana. Prana is a subtle energy which just keeps us awake, alert, and alive. Prana is not your breath. Metaphorically, if the breath is your electric cable, prana is the electricity. The breath is the carrier of prana. In a yoga practice, our whole body does the breathing. Visualize breath is taking the prana to the organ of healing. It's called the pranic healing technique. I have a disease of my heart. I'm visualizing prana is coming to my heart and causing the pranic healing. If you have a back pain, you visualize prana is coming to your back, to taking care of your back pain. You can visualize the prana is going to your pancreas if you have a diabetes. Prana is going to your hip joint or knee joint if you have a problem with the hip joint or knee joint. Pranic healing technique. You have also a pranic energizing technique. For the meditative practice, a pranayama takes you to your practice. For a focused meditation, we do alternate nostril breathing without closing our nostril. How is it possible? We have three bodies. One is called a gross body, which is connected to our body. Then it's called a subtle body, connected to our mind. You've got a causal body, which is connected to our spirit. The subtle body, the body of the mind, is everywhere. Here, I'm in my home, but my subtle body could be in that yoga studio, the Sattvic space, which I used to teach in person. I'm visualizing I'm entering through the gate of the Saktic space. I'm getting there, sitting down, started practice. Or in my physical body, when my eyes are closed, I can take my hand, I can touch the tip of my nose. The left hand, I can touch my right knee. The right hand, I can touch my right great toe. I can touch my top of my head. So I can touch any part of my subtle body. So when you are in a practice of subtle body, with your focused meditation, you'll be able to breathe in and out through one nostril without closing the other. Meditative alternative nostril breathing. Let me show it to you. You will be doing silence, you'll be doing the eyes closed, and with a short time you'll be able to do it. With my eyes closed, I'm breathing out through my left nostril. I'm breathing in through my left nostril. I'm breathing out through my right nostril. I'm breathing in through my right nostril. Breathing out through my left nostril. I'm clearly visualizing that I'm breathing in through the left nostril. Breathing out through the right nostril. Initially may be impossible, but within a short time you will be able to do it. You do it with your eyes closed. For me, I have the health tracker, I can check it, but before that, I have this mudra. I'm touching my index finger and thumb. I'm literally losing my sensation. I don't feel like I'm touching. I started feeling the capillary pulsation, the pulsation which I was not feeling before. Now I can clearly feel that I have a pulsation in the tip of my index finger and tip of my thumb. When you be practicing, that is your meditative parasympathetic activation. I have saliva in my mouth. My mouth is wet. That's a sign of parasympathetic activation. And at the end of the meditation, you always do called pumming and cupping, which I showed you first time. Chanting meditation, you can continuously chant sound of Om, or you can do a pranabha pranayama with the sound of A, U, Ma, E, U, M. With the Om pranayama or Om meditation, you continuously chant Om. 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 You can keep on practicing, but I just wanted to show it to the technique, and because of the lack of time, I'm going to continue all the meditative practices today. But always breathe out first. Take a deep breath in through your nostril. also extends your exhalation. Pranava pranayama with AUM. When you touch your index finger and thumb, put your palm high up. This is a Jnana Mudra or Dhyana Mudra. You put your hand down, this is called a Chin Mudra. It opens your lower part of the lung. If you close your other fingers, it is called Chinmay Mudra. It opens the middle part of the lung. And if you take your thumb inside and close, this is called a Balo Mushti Mudra. Bala means baby. That's the way a baby closes the fist, or called Adhi Mudra. It opens the upper part of the lung. The babies will scream, will cry with their hands like this to open up rest of their lung. Chin Mudra, hands down. Start with the first sound Ah, lower part of the lung. Breathe out first. Take a deep breath in. From middle part of the lung with the Chinmay Mudra. Close your hand. Breathe out first. Ma from upper part of the lung with the Adhi Mudra. Always finish with the pumping and cupping, which I've shown you before. We can analyze the capillary pulsation through a machine called plethysmogram. If I put a plethysmogram on my finger now, I could have shown you that what is the increase in the blood flow for a capillary pulsation. As I said, loving, playing, meditative practice. Play with your grandchildren with a meditative practice. Mindfulness meditation, whatever you are doing is a meditative practice. You can do relaxation with a meditative practice and with your body scanning. 3 techniques you have. You can lay down on your mat and do the relaxation technique and body scanning. When you lay down, keep your feet width apart of your mat, hand on both sides, palm facing high up. When you relax, you'll see your whole hand will touch the ground. You don't make any effort. In the relaxation, your thumb, your little finger, all the fingers will touch. Also keep your chin below your head. If your head is like this, you put something underneath your head, otherwise you do it here. You can do a body scanning slowly. Or you can start with an instant relaxation technique, quick relaxation technique, deep relaxation technique. We'll do the body scanning with the deep relaxation technique. In an instant relaxation technique, what you do, you contract all the muscles of your body from toe, head to toe, and then suddenly let go. For example, contract, contract, contract. Keep contracting your muscles and then suddenly let it go. Instant relaxation technique, and you will feel the relaxation. And also you can check with your health tracker. Contract. In this relaxation, you will even see your breathing becomes deeper and deeper. Now I can, without a large amount of air, breathe in maybe 2, 3, 4 times of a normal breathing. Quick relaxation technique, deep relaxation technique with the body scanning. You are in the mat, your feet are all separated, your hand is on both sides, about 6 inches from your body. All the fingers are touching the ground with the palm facing up. Bring your awareness to your toes. Your eyes closed, visualize your toes. Visualize all of your toes. Visualize your feet. You will be practicing with the silence with eyes closed, so you will see that you will be able to visualize very clearly. Visualize your ankle. Visualize your legs. Visualize your knees. Visualize your thighs. Visualize your hip joints. Visualize your abdomen. Visualize your abdominal breathing. Your abdominal wall is going high up with the inhalation, going down with the exhalation. Follow your breath. Visualize your chest. Visualize upper part of your chest. Visualize your neck. Visualize your face. Visualize your head, top of your head. Bring your scanning down to your both the shoulders, both the arms, the elbows, the forearm, both the hands and all the fingers. Visualize your breath. Your breath will be complete effortless, and the breath will be the deep breathing with a long effortless inhalation and the long effortless exhalation, reducing the rate of your breath and increasing the total quantity of air you are breathing in and out. Control your 5 senses. Learn how to control your other senses. When you are reading, put your focus with your eyes. Shut down your hearing, your smell, taste, and touch. When listening to a music, shut down your other senses. When you put something in your mouth and trying to appreciate the taste of it, shut down other senses. Focus. Most important body scanning focus is able to bring your focus in between your eyebrows, which is your third eye. Your breathing will be so effortless at this point, you will have a profound sense of relaxation. With the focus in your third eye, you will get the focus will enter into a meditative practice. Profound relaxation technique. When you finish again with your palming and cupping. Then put your body on the left side, bend your knees in a fetal position, keep your head on your folded hand, slowly straighten up your right knee and get up and sit down, in your Sukhasana. Also notice with your balancing practice, so change my leg and I'm in an opposite Sukhasana. Spiritual practices are meditative practice. Every religion has your meditation. From the yoga therapy perspective, from a medical perspective, it's your chakra awakening meditation. It's a therapeutic meditation. Chakras are potential energy centers. Our yogic rishis, when they closed their eyes, they saw the color in front of your eyes. I hear from so many people, I'm in a meditative practice, I'm closing my eyes, and I see a burst of color in front of me. For them, the color was the color of the rainbow. Violet, indigo, blue, green, yellow, orange, red. So assign those 7 colors in sequence from your top of the head to your root of the spine. Along the spine, assign the chakras. Chakras are like a wheel. We have 3 main channels called nadis. We have thousands and thousands of channels called the nadis. The one comes from the left side and goes crisscross around our spine and comes out to our left nostril is called an ida. One comes from the right side, crisscross the spine, comes to the right nostril is called pingala. And one in the central channel nadi is called a Shushumna nadi. When the ida and pingala nadi crosses each other, this is called the site of your chakras or wheels. Each chakra is connected with your body system. Each chakra has their own nervous plexus. Each chakra has each endocrine organ. Each chakras are in a state of imbalance. So the name of the chakras from the head down. Violet. Or let me describe all the chakras, so then we'll do the practices how to balance these chakras. From the root of the spine is called your root chakra, Muladhara chakra. Its color is red. It has 4 petals which are in a state of imbalance, connects to your musculoskeletal system. Its function is a power, and if you have a disease of the musculoskeletal system, like a back pain, knee pain, hip pain, you will meditate on this chakra. There's a sound to balance the chakra called lam. We'll practice it. There is asanas, pranayamas, mudras and bandhas to balance these chakras. We'll only practice today the chanting mantras for chakra awakening meditation. Just to give you the information, the asanas will be grounding asanas. Lotus pose, Padmasana, closed angle pose called Baddha Kodasana. Pranayama will be Kapalbhati Pranayama, a breath of fire. Mudras will be called a Shakti Mudra, because this chakra is connected to your earth element of the 5 elements. The 7 chakras, the lower 5 chakras connected to your body. Our body is the space, air, fire, water, earth. 6th chakra will be your mind, 7th chakra will be your spirit. Bandhas to balance this chakra is your Mula Bandh, the root lock. In between your belly button and spine is the next chakra, pelvic chakra, Shadhisthana chakra. Color is orange. The 6 petals connected to reproductive system. Function is a procreation. Connected to the water element of our body. sound to balance this chakra is called Vam. Asanas to balance this chakra is called Brahmachari Asana, which is sitting in like a Vajrasana, the thunderbolt pose with the feet turned outside. Squatting pose, Malasana, or the warrior pose, warrior 2. Pranayama will be the Kapalbhati Pranayama. The water element will be mudra, will be Varun Mudra, touching your little finger and thumb. And bandhas will be your Mula Bandh. Bring your awareness to your belly button. At the level of the belly button, you have the third chakra, solar plexus chakra, Manipur chakra. Oh, before I forget, the connection of the plexuses and endocrine organs for the root chakra, Muladhara chakra, the plexus is the sacral plexus, and the endocrine is the adrenal gland. It's connected to adrenal gland. For the pelvic chakra, Swadhisthana chakra, it is your gonadal plexus, it is your pelvic plexus, and it is your gonads, ovaries and testicles. Third one is said your Manipur chakra, solar plexus chakra. It is connected to your endocrine function of the pancreas. It is function is the control, power, procreation control. Color is yellow, 10 petals, and the sound to balance the chakra is a ram. Asanas to balance, Vakrasana, spinal twist, Naukasana, boat pose, Marjarasana, cat pose. Pranayama, Bajja Pranayama, which is your breath holding in exhalation with your abdominal lock. Mudras is called your Pachan Mudra, ring finger, middle finger and thumb, which is the fire element and digestion. Bandhas are the Uddiyani Bandh, abdominal lock. It balancing this chakra ascends this potential energy from the root of the spine will be to the crown of your head, which in yogic tradition is called a Kundalini Jagaran. Fourth chakra, heart chakra, level of your heart, Anahata chakra, color is green. 12 petals connected to cardiovascular system, connected to your cardiac plexus, endocrine gland is the thymus. Sound to balance the chakra, Yam. Asanas like Bhujangasana, Cobra pose, fish pose, Matsasana, all is chest opening poses, Paschim Namaskar, prayer pose to the back. Pranayama, because its element is your air, will be alternate nostril breathing, Anulom Vilom Pranayama. Air, the mudra will be your Vayu mudra. Index finger down, thumb in the top. And bandhas will be Uddiyani Bandh or abdominal lock. Fifth chakra, throat chakra, Vishuddha chakra. Color is blue. Or the function of your heart chakra, Anahata chakra, is a love. L-O-V-E, love. So fifth chakra, Vishuddha chakra, blue in color, 16 petals, connected to respiratory system, and the function is the communication. Sound to balance the chakra is a hum. Asanas to balance this chakra is your rotation of your neck, is called Brahma Mudra. Very important, Brahma Mudra. It is connected to your space. Pranayama will be your Ujjayi Pranayama. Ujjayi Pranayama. Mudras will be the Shunya Mudra, space, touching your middle finger and thumb. And bandhas will be your chin lock or Jalandhar bandha, bring chin down to here. Sixth chakra, in between the eyebrows. Oh, the connection to the throat chakra is your pharyngeal plexus. Nervous connection, endocrine connection is a thyroid gland and parathyroid gland. Sixth chakra, Agna chakra, in between your eyebrows and the third eye. Color is indigo. It are the two petals connected to your endocrine system, connected to your vagus nerve or parasympathetic nerve. And endocrine is connected to pituitary gland. Sound to balance this chakra is a sham. Asanas to balance this chakra is your Balasana, child's pose. Shashanka Asana, rabbit pose. Sharbanga Asana, shoulder stand. Halasana, plow. Pranayama will be your Om Pranayama. Mudras will be your Dhanu Mudra or a Gyanu Mudra. Bandhas will be your chin lock or Jalandhar bandha. And you're ascending the spiritual and potential power from the root up to the crown of your head. Seventh chakra, Sahasra chakra. Color is violet. 1,000 petals. Connected to nervous system. Function is the bliss. Sound to balance this chakra is Om. Asanas to balance this chakra is a headstand, Shishasana. pranayama here is your pranabho pranayama. Om pranayama with a, u, ma. Pranabho pranayama. Mudras again, Dhana mudra, Gana mudra. And bandhas is a mahabandh or a great bandh with all the three bandhs together. Root lock, abdominal lock and chin lock. Mula bandh, Udyani bandh and Jalandhar bandh. Let's practice the chanting balancing of the 7 chakras. Normally when we do the chakra balancing practice, we do all. We do asana, pranayama, mudras and bandhas and the chanting. Again, sit down comfortably in a chair or in a ground. Again, asana is sthiram sukham asana. Visualize your lower part of the spine. Visualize a wheel, chakra, the 4 sides, red in color, and touch your finger in a Shakti mudra, little finger, ring finger and thumb. Connected to your musculoskeletal system, connected through your sacral plexus, adrenal gland. Sound here is a lump. So breathe out first, take a deep breath in and breathe out with the sound of a lump, like this. Breathe out first. Take a deep breath in. Lum. Visualize it between your belly button and the root of the spine, pelvic chakra. A wheel with a 6 wheel, they're unbalanced and the color is orange. It's a Varun mudra. Water element, touch little finger and thumb. It's also connected through your taste. Connected to the water element, the root chakra, the earth element is connected to your smell. Also connected with the reproductive system. So any disease in the reproductive system, you'll meditate on this chakra. You will do all 7 chakras, but do more on this chakra for your reproductive system. This is. Sound here is a vam. Breathe out first. Take a deep breath in. Vam. connected through your pelvic plexus and the gonads. For the man it's testicle, the woman is the ovary. Visualize at the level of your belly button. Solar plexus chakra. Visualize a chakra yellow in color with the 10 petals connected to the fire element, and in the digestion put your hand in a apna mudra or a pachan mudra, middle finger, ring finger and thumb. Connects to your gastrointestinal symptoms. In gastrointestinal syndrome, most of the diseases are the functional disorder, except the ulcers, tumors, and the inflammation. You'll be balancing this chakra. Sound here is a ram. Breathe out first. Deep breath in. Ram. It's also connected with your solar plexus and the endocrine organ of your pancreas. Visualize at the level of a heart chakra, anahata chakra. Color is green, 12 petals. They're in balance. Connected to cardiovascular system, connected to cardiac plexus and the endocrine gland thymus. The element is the air element. Mudra is a Vayu mudra. Put your index finger down and thumb high up. Bandhas will be Uddiyani Bandh. And asana practice will be your Bhujangasana, cobra pose, fish pose, chest opening poses. Pranayama will be your alternate nostril breathing or Anuloom pranayama. Sound here is yum. Breathe out first. Take a deep breath in. Yum. Bring your awareness to the throat chakra, Vishuddha chakra. Color is blue. 16 petals connected to respiratory system. Function is your communication. Sound here is a hum. Asana is a Brahma mudra, moving your neck. Pranayama will be Ujjayi pranayama. be a Shunya Mudra, space, touching your middle finger and thumb. And bandhas again will be Jalandhar Bandha or the chin lock. Let's practice hum, the chanting. Breathe out first. Take a deep breath in. Hum. Connected to pharyngeal plexus and thyroid and parathyroid. Bring your awareness in between your eyebrows, Agga chakra, connected to your endocrine system, connected through your vagus nerve, parasympathetic activation, and your pituitary gland. Sound to balance this chakra is a sham. Mudra will be your Dhyana Mudra or Jnana Mudra, touching your index finger and thumb. And the bandhas will be your Jalandhar Bandha, chin lock. It will, all the endocrine system will be practicing on this chakra. Sound is sham. Breathe out first. Take a deep breath in. Sham. Bring your awareness to the crown of your head. Color is violet, 1,000 petals, Sahasra chakra. Connected to nervous system, function is bliss. Connected to pineal gland for the endocrine, and for the nervous is the supratentorial cortex of the brain, cerebrum. Mudra will be again Dhyana Mudra, Jnana Mudra. Asana will be a Shishasana headstand. Pranayama will be Pranabho Pranayama. A, U, Ma with the Chin Mudra, Chinmaya Mudra, Nadi Mudra. Bandhas will be the Mahabandh, the great lock. All the three bandhas together. Root lock, abdominal lock, and a chin lock. Mula Bandh, Udyani Bandh, then a Jalandhar Bandh. Sound to balance the chakra is an Om. Breathe out first. Finish again with a humming and tapping. Rub your hands as hard as possible. When you feel the warmth, people wearing glasses, remove your glasses, take the hand, put it over your eyes, let the eyes take all the heat. Massage your forehead, massage your eyes, massage your face. As I said, muscle relaxation will remove all the marking, all the itching. Massage you behind your ear, in front of your ear, inside your ear, massaging your auricular branch of the vagus nerve, massaging your carotid sinuses to be a vagal activation, quieting down the nervous system and cardiovascular system, massaging behind for your sternomastoid and trapezius muscle and the cranial nerves. Bring your hand, touch your little finger and thumb and put it in front of your heart chakra. This is your Padma Mudra, Lotus Mudra. It connects your body, mind and spirit. The soul is the heart, is the side of the soul. Put your mudras at the heart. Meditation is the medication. At the level of meditation, daily practice, you have a profound parasympathetic activation to overcome the sympathetic activation of a stress. Stress is the root cause of all of our chronic lifestyle related disorders, metabolic syndrome. Once you overcome this sympathetic overdrive, you are in a state of your parasympathetic activation. You will be, this is free, medication free, and will be enjoying in a good quality life and living. This comes from the extensive practice what we have and the testimonial from all the people who have been practicing with us. Put your hand in front of your heart chakra, bow your head down, and you say Namaste. Namaste means I honor the divinity within you. You are divine, and it's a divine practice. This is meditation. Continue. I just talked about too much to give you all the explanation, but when you do the practice, it is not going to take much time, and it will be a wonderful experience for your daily asana, pranayama, and the meditation practice. And as you all know, I'm sitting on this, my kneeling stool, and all of you have seen the kneeling stool. Thank you again. I'm here every Saturday and will bring your a new practice every time, and especially with a request. Please send a request on your comments or questions, and I'll be glad to answer for you. Okay? See you next Saturday. Bye-bye.